Hello everyone, my name is Taylor Lazowski. I am going to be presenting Leadership Related to Quality and Cost Containment, a Pressure Injury Prevention Project. These are the learning objectives and goals for this presentation. Just an overview, nurse leaders are an important part of healthcare as they inspire, motivate, mentor, and encourage nurses to be their best and reach goals. Pressure injuries are a major healthcare issue that impact patients, quality care outcomes, and the finances of healthcare facilities. Through evidence-based research about effective leadership qualities and styles, along with effective interventions for pressure injury prevention, nurse leaders can play a role in decreasing pressure injury rates, improving quality care, and decreasing health facility costs. So leaders, what do? Leaders inspire shared visions, they challenge processes, enable nurses to act, model commitment, encourage care from the heart, and celebrate achievements. Along with this are some great qualities of leaders such as honesty, integrity, being accountable and committed to their work, having great communication skills, and being innovators for healthcare change. Leadership styles, which is best? It's difficult to pinpoint which style is best as any given situation may yield a different type of style to be needed. I'd say my favorite is transformational. And just to go in a little bit more detail, a transformational leader works with teams to identify change. They are committed and an integral part of a team, and they also coach and mentor. A servant leader has a main goal to serve and thrive in a company. A democratic leader has a participative role in decision-making processes. They encourage innovation. An authoritarian leader has total decision making and absolute control. I'd have to say this is my least favorite type of leadership style. I do think that it is important given certain situations. Probably not the best in healthcare as there's many different workers and disciplines that need to come together to make decisions, which leads into laissez-faire, which is another favorite of mine, which is a delegative style. It allows the group to make decisions. Most of us have probably seen this in a unit committee where different members of the unit come together to discuss changes and practices that they may want to implement in the unit, and they come together as a team to make changes. Some interesting evidence-based findings about leadership that I found, first by Apollo Gray and Spies. By advancing their leadership skills, nurses can effectively advocate for organizational changes that address broad factors related to workplace safety concerns, retaining and attracting nurses, fostering teamwork, enhancing professional growth, and increasing job satisfaction. I'm going to read the second one by Saranto, Arianti, and Kadar. Effective leadership styles, such as transformational leadership, are attributed to nurse retention, healthy work environments, and increased nurse recruitment. I feel that both of these have similar messages, just stating that different leadership styles that are effective and leaders as a whole are very important in healthcare in creating healthy work environments, increasing nurse satisfaction, and attracting nurses to the workforce and individual healthcare facilities. Lastly, by Pullen, there is a need for leadership at all levels of nursing practice. Although our roles may be different, according to educational preparation and experience, we all have one common goal: to provide safe, quality patient care. All healthcare facilities should have a goal that's focused around a patient. And as an individual nurse, you need to look around and see who the leaders are in your facility, because typically they are prepared in graduate levels, such as the clinical nurse leader, the nurse practitioner, and they're there to help you and improve patient outcomes. This project's all about pressure injuries, so just a quick definition. Pressure injuries are also known as bed sores or pressure ulcers, and they are tissue injuries resulting from prolonged pressure on the skin. Pressure injuries usually develop on skin over bony areas such as heels, ankles, and hips. I'm sure everybody has probably seen a patient with a pressure injury or has heard a story. Pressure injuries can be very painful for patients. They can cause prolonged stays in the hospital. They can cost health facilities a lot of money. So that is why this author focused on pressure injuries as a quality and cost project for leadership. So delving into the details a little bit further, this is going to be a 6-part pressure injury prevention program with a care plan, having a turn wedge and pillows for each patient, having less than 3 layers of linens on the bed, with Mepalexis on the sacrum and under tracheostomies and gastric tubes, which are common areas for pressure injuries under devices. The strategies to get the word out are going to be through emails, educational sessions, and posters. I chose 3 because sometimes people don't always read their email. They go on vacation, they lose their password. It can take days or weeks, or you may skim over it. For the educational sessions, sometimes nurses are going after night shift and they're tired, zoning in and out of information. So I figured if I did 3 modes of interventions, a nurse should be inclined to hopefully have all 3, but at least take the information from one. The clinical nurse specialist, educator, and leader is going to be responsible for educating staff, being resources for concerns and comments, and having bi-weekly evaluations to assess the project and celebrate achievements. Nurses do not always receive the recognition that they deserve, so even celebrating something as small as meeting all of the 6 interventions for all 3 or 4 of your patients is something that should be celebrated. And lastly, performing an assessment and evaluation of pressure injury occurrence pre and post implementation so we can see if this project is indeed effective. This author chose this topic because she worked with an amazing clinical leader this semester who is a skin champion. She unfortunately does work with one unit that does have high pressure injury rates, which is kind of what prompted this whole project to be implemented. So nurse leaders have an important role in this. They're the educators, mentors, and coaches in this prevention program, and I believe a transformational leader would be the best style for this type of program. Patient outcomes and quality care are going to be improved, and hospitals are going to receive payments from patients for provided care and have decreased costs related to decreased pressure injury prevalence. So in the literature review, I found 5 different articles that go into more detail about leadership and pressure injury prevention success. So the first one by Yilmazer and Bolt discovered the effects of a pressure injury prevention algorithm in an ICU setting. So there were 80 participants in the pre-algorithm phase and 74 in the post-algorithm phase, which consisted of pressure injury training about skincare, nutrition management, moisture management, and support service management. And there were statistically significant results with pressure injury rates decreasing from 46.1 to 9.2 per 1,000 patient days. What I liked about this study was this algorithm is similar to the one that I've created, and there was a statistically significant decrease in pressure injuries, so I'm hoping for the same results. Effectiveness of sacral dressing and pressure injury prevention by Padula. This author actually uses Mepilex at her facility for sacral dressing, so I'm curious to see if anybody else uses any kind of prevention for the sacral area at their facilities. So this was a retrospective observational cohort study. Some interesting findings. 2.5 million patients obtain pressure ulcers annually, costing $11 billion. Litigation costs can cost upwards of $250,000, with an unfortunate number of 60,000 deaths annually from pressure ulcers. So after the implementation of the 5-layer sacral dressing, pressure injury rates decreased from 1.72 to 0.62 in a 5-year period per 1,000 patients. And the cost also decreased from $120 per patient to $43 per patient. This journal was very interesting as the results showed not only a decline in the pressure ulcer rates, but also showing the decrease in cost associated with this. Black and Magley performed a research study determining how a change project decreased pressure injuries. This project was called Help You, which stood for Help You Prevent Pressure Ulcers, which was just a cart that contained various methods of pressure injury prevention strategies such as skin prep, barrier cream, heel boots, and positioning wedges. So the 2 units under examination actually had 0 pressure injuries, which is amazing after the implementation of the Help You project. The financial benefits were $111,400 saved just in the first year post-implementation. Researchers also state that staff engagement leads to quality care, and committed leaders are necessary who support education, personal growth, and the project as a whole. What I liked about this journal article was that it explains how important the leader is in being effective in a project such as one as decreasing pressure injuries. Next is How the APN Impacts Pressure Injury Events by Irvin Sedlak, Walton Collier, and Bernhofer. This was a retrospective comparison design with 10,752 patients. What was interesting about this was they evaluated how pre- and post-nurse practitioner hiring affected pressure injuries. All nurses received the same education about skin assessment, nutritional support, repositioning education, and redistribution surface for pressure injury prevention. And researchers found a significant inverse relationship occurring between nurse practitioner presence and pressure injury events, going from 9.5 to 1.6 as a mean number. Researchers found that advanced practice nurses definitely influence quality care, and what I thought was great about this article was showing again that nurse leadership, along with an effective intervention, has positive outcomes for patients and the health care facility's economic status. Lastly, is an educational program effective in preventing pressure injuries by Henry? This was a quality improvement project with goals of increasing pressure injury prevention knowledge. So, researchers used pressure injury prevention strategies from scholarly database research, with 129 nurse participants completing the educational program, and with the 117 nurses completing the satisfaction survey, 79% were satisfied. Ideally, you'd like to have 100%, although that's probably unrealistic. 79% is still a great number. As I am having an educational program, I would aim to hopefully have a similar satisfaction rating. So, the impact of leadership concept on delivery of healthcare. Leadership strategies that ensure best practices for pressure injury prevention. Leaders need to design a vision, ensure efficient management, set goals, definitely use evidence-based practice, identify clinical champions, and I say this for last, making the connection between boardroom and bedside. Sometimes upper management may be away from the bedside for many years, and I feel it's the nurse leader that's responsible for making that connection for both sides, so that way everybody reaches a common goal that is attainable. So again, the impact of leadership concept on delivery of healthcare for this individual project. Patient outcomes and quality care are going to be improved in response to effective leadership and a pressure injury prevention program due to decreased pressure injury events. Patients are not going to experience pain. They're not going to have longer healthcare stays. They're not going to need nurses to come to their home. They're going to have increased quality care and better outcomes. Morbidity is going to be decreased, as we remember reading 60,000 deaths from pressure injuries. So with effective leadership in this program, we can improve quality care again. And healthcare costs are decreased due to decreased pressure injury events and less costs associated with pressure injuries. Fewer lawsuits, greater financial reimbursement, decreased hospital stays, and no unnecessary care for pressure injuries. We're saving nurses time from having to do long dressing changes. We're saving healthcare facilities money by not having to use gauze, Santyl, hydrogel, all of these unnecessary items for these unnecessary pressure ulcers that we're not going to be having anymore. Some recommendations for practice. What can nurse leaders do? They can involve leaders in healthcare changes. This project's about pressure injury prevention, but there can be one about collapses, caudities, falls, or medication errors, or even others. I wonder if there's anything in your healthcare facility that you think a nurse leader should be involved in. We should have nurse leaders be educators, mentors, and coaches during changes. We should evaluate interventions and make changes when needed. Healthcare is always changing. There's always chaos. We need to adapt to it and make changes. Things don't always go to plan. And lastly, using evidence-based practice. We need to go to the evidence and use the best practice available. We can't just keep doing things because it's the way that we've been doing them. And here are the references. Thank you so much for listening. If you have any questions, comments, or concern about this presentation, please post them to the discussion board and I'd love to answer. Again, thank you so much.